Very difficult to function at work. I work in a large office. It was difficult to understand what anybody was saying. I'd have people repeat. I was saying what, 17 times a day. Well, my symptoms started in January of 2015. I had a virus, sore throat, fever, ears were plugged, so everything was very muffled, and it lasted for a couple of weeks, typically. And my fever wasn't going away, so I went and got an antibiotic for 10 days. Fever and sore throat subsided, but the hearing did not resume. I'd been going to doctors since then, getting second opinions and trying to figure out what it was.
And she was frustrated because she had seen several physicians, was placed on different medications and other treatments without any significant success. Her left ear was, by the time she had seen us, pretty much gone. She also had dizziness and headaches and ringing in the ears.
What struck me when I first came to see him was just his compassion. He listened and he was very concerned. You could see in his face that he really felt bad that I'd lost all my hearing.
Sudden hearing loss is thought to be a viral condition. It could also be autoimmune, where the hearing changes subtly in the ear. It happens typically in 3 frequencies, 30 decibels or more.
She wore a hearing aid, but she wasn't getting the word recognition that she needed to function. And she was pretty distressed when we first met her. So we chatted, we did some testing. I assured her that she stood a very good chance of doing well with the cochlear implant.
We have a process here to make sure that our patients are seen by all the necessary specialists, ideally on the same day they see us. For Deborah, when we made the decision that a cochlear implant would potentially help her, I had her see Stephanie Allen in audiology, who has special training in cochlear implants. We did the surgery, which was done outpatient, so she came in, had the surgery, takes about an hour, hour and a half, went home the same day.
The surgery was really uneventful. I was out within 2 hours, in and out within 2 hours. The recovery was good.
And then we let her heal up for 3 to 4 weeks. And then on that follow-up visit, I examine her, make sure the wound is okay. I hand her off to Stephanie, and Stephanie can turn her on that day, can activate the implant.
She's been doing very well with her implant, and she was scoring with her word recognition from 13% to now 86%. And then when we added in her right ear without a hearing aid, she was getting 100% on her word recognition. So we are so thrilled for her.
I've gone from not being able to hear anything to hearing very well and functioning again. So I was able to have all 3 of my children and all 5 of my grandchildren for an early Thanksgiving, and I was able to hear what everybody was saying. Even amongst the noise that 5 kids under the age of 7 can make, I was able to hear everything and not say what.
We deal with the communication aspect of patients. Anytime we can improve or restore those senses and improve their quality of life, you just feel great. And there's nothing more gratifying than that.